Q Local News.
All right, Patrick, thank you. We know many of you do have questions about the measles virus, so tonight we brought in an expert for you. Right now we have Kim Papich. She's from the Spokane Regional Health District here to answer any questions you might have. And Kim, how quickly can an outbreak of measles spread?
So the exposure period that we're looking at is 4 days of a person being contagious before they develop their rash, and 4 days after their rash is when they're contagious. And then there's an additional 21-day window waiting period where another person, the next person that's exposed, would develop their symptoms. So we're looking all the way into mid-May to determine if we are in the clear or not.
Yeah, that's quite scary because you look at the Disneyland situation, and this is why a lot of folks might be asking why there are only 2 cases. Are we making such a big deal out of this? Can you explain?
You know, I think it's generational. There's generations before mine that are old hands at measles, mumps, chickenpox, and then you get into a generation like mine that's got young kids. We know that vaccines are safe, that they're low risk, that they're much more low risk than some of these diseases that we're faced with. And then when you think about children under 1 year old and possibly losing one of them from measles in our community, that's too many.
Well, and it starts with flu-like symptoms. Is there a certain spot on your body where this rash may develop?
So the rash typically develops on the chest and the hands and then spreads upward toward the face.
Okay. All right, Kim, I know that a few folks are asking you questions right now. Can you tell me one of the most important ones that have been asked?
A lot of confusion out there about the difference between natural measles versus vaccine-based measles. What happens is when people are exposed to measles and they know they might have been exposed, a lot of them rush out and they get the MMR vaccine. And so then when we go back to test them, we sometimes get a false positive because we're seeing that vaccine when in actuality the person really does have that wild version of measles.
All right, Kim, thank you so much for being here tonight. If you have more questions, please post them on our Facebook page. Kim will be here until 6:30. All you have to do, search KHQ Local News and join in on the conversation.
And with the